All right. All right. So hello, everyone, and welcome to the CDC Model Aquatic Health Code Network webinar series. My name is Olivia Toure. I'm a program analyst at NACCHO, and it's a pleasure to be here before you today. And again, we welcome everyone. In today's webinar, we'll be hearing updates to the 5th edition Model Aquatic Health Code from Dewey Case, who is with the Council for the Model Aquatic Health Code. But before we get started, I have a few logistic items to update you all on. First, I want to make sure everyone is aware that this webinar will be recorded, and the recording link will be shared along with the presentation slides in the wrap-up email concluding today's call. So our registrants will be receiving that follow-up email. So just be on the lookout for that email, I would say in a few days. Also throughout the webinar, we encourage you to ask questions, and we ask that you use the Q&A box located at the bottom of the screen to put in your questions. Again, there's a box you can enter your question, but there's also an opportunity for you to upvote any questions that you would like to see answered. And again, these questions will be addressed during the Q&A portion of the webinar. Looking at the agenda, we will start with some announcements from NACCHO. Then we will move on to today's presentation. And again, we will have our question and answer session, so please keep track of your questions. And we look forward to having a great and informative discussion at the end. Moving on to NACCHO announcements. NACCHO is offering scholarships to those who are looking to become a certified pool operator. The scholarships will be awarded on a rolling basis, and there's an interest form that is available for prospective recipients to fill out. The form will also be included in the wrap-up email as well. For those who are interested, if you're new to our MAC webinar series, we definitely encourage you to check out our past webinars. We have 37 past webinars where you can view and our past recordings and slides at thenaccho.org/MAC site right there shown on the screen, as well as the YouTube playlist listed here as well. Those are all the announcements, and now I will introduce today's speaker. Today we have Dewey Case, who serves as the Technical Director for the Council for Model Aquatic Health Code. His career started as a part-time lifeguard involved into servicing pools, then began managing aquatic facilities while in college. He has served in various roles with the YMCA of the USA, the local and state chapters of the American Red Cross, on the Lifeguarding and Bather Supervision Technical Committee for the MAC First Edition, and on the Technical Review Committee for the MAC Third Edition, as well as managing various aquatics facilities in the public, private, and nonprofit sectors over a 26-year span. He holds multiple instructor training certifications from the American Red Cross, as well as instructor credentials with the Pool and Hot Tub Alliance. Let's give a warm welcome to our presenter, and I will pass it over to you, Dewey.
Great. Thank you, Olivia. Very, very glad to be here. Next slide, please. So as Olivia mentioned, we're here to talk about 5th edition MAC changes, and very, very happy at the rollout for this edition. The MAC is now officially over 10 years old, with the first edition rolling out in 2014. And we're very, very, very pleased as a staff with CMAC and also with our CDC partners that this was able to be released in December. Next slide, please. So here's a general timeline, right? So we opened up for change request submissions April 1st of 2023, and that went on through October 13th. We had the first comment period that opened along this time frame, as well as our TSC and TRC volunteers started working simultaneously along with all the CR submissions. The TRC was able to complete the entire review on December 13th, 2023, and that opened the second comment period, which ran until February 9th, 2024. The vote on the code conference for the 5th edition was held February 15th, 16th, in conjunction with the AOAP annual conference in Reno, Nevada. This was 2024. So a little bit over a year ago, or around a year ago, rather. Voting opened at February 17th, closed March 17th for a 30-day voting window. And then CMAQ was able to deliver track changes for both the code and the annex on time on April 30th, 2024. And the MAC 5th edition was officially released by CDC on December 14th of last year, just a few too short months ago. Next slide, please. So we want to give us very, very special thank you, and this largely goes out to our partners at CDC. We always have our thank yous for our wonderful volunteers with the Technical Review Committee and our technical support committees, of which none of this could happen. We attract the best of the best. We truly live out our motto at CMAQ every day of driven by your expertise. And we're very, very thankful to have the caliber volunteers that we do. But a very, very special thank you to Commander Joe Lako with NCEH, and then Commanders Jason Coons and Amy Freeland with Easy ID at CDC. These three individuals were absolutely key in getting the MAC through all 6 centers of review at CDC, as well as 508 compliance. And this was done really very, very early. I believe they had everything completed and the MAC ready to go by late August, early September of 2024, which was just an amazing, amazing time frame and turnaround. There's also a little bit of symbology there that we didn't really count on, right? But the MAC first edition was released in September of 2014. So there's a little bit of harmony there for the MAC 5th edition, the 10-year anniversary of the MAC being released in the fall of 24. So again, if you see these commanders, please shake their hand and give them the thanks for having a very fast and efficient MAC release. Next slide, please. Next slide, please. There we go. Thank you. So we did a couple of things as an organization to help streamline this process, and this was all relating from the 4th edition, right? The 4th edition was an outlier on one specific way, in that the sheer number of change requests that were submitted during the pandemic, during the early days of COVID, were definitely an obstacle to overcome. So we took some lessons home out of that. Part of that was we acknowledged that the sheer number of requests for the 4th edition was just a significant challenge on our volunteers. And I don't know if she's on, but I want to give a special shout out to Amanda Terrier she was our TRC chair for the 4th edition. Amanda will forever live on in the halls of amazingness. Without her organizational skills and her attention to detail in the midst of COVID as a public health official, the 4th edition would not have gone off as well as it did. But this did expose an issue of all of these CRs, right, and the work our volunteers having to put in. So we wanted to streamline the process. We want to improve workflow for our volunteers. We also want to make the CRs overall much better quality. Next slide, please. So we identified 4 areas of change. One is we wanted to limit CR submissions to 50 entries per person. We only allowed substantive changes, no editorial CRs, no MAC Annex CRs, and then we made some general overall improvements to the process. Next slide, please. So on limiting CR submissions, right, we wanted to limit it to 50 per person. This is not an entirely arbitrary number. We went through and analyzed what's an average number that an individual would submit to the MAC or to CMAQ for what's an average number an individual would submit to a MAC revision cycle as a change request. And that number kept consistently coming up as 5. We had a few outliers where one person submitted 100, another person submitted 100 plus, but 5 was the consistent number. And we wanted to be very specific, right? Very purposeful in not arbitrarily limiting quality change requests. But we did want to avoid nuisance change requests, right? So what does that mean? Olivia submits a CR to make the minimum chlorine level 20 part per million. She doesn't know if that's going to get through, so she submits another CR to make the minimum level 15, and she submits another to make it 10. Right. So that's what I mean by nuisance CRs, right? The political jockeying, so to speak, to try to get something close to what an individual wants. So we took that number 5, that average number of CRs, multiplied it by a factor of 10. So we're up to 50 CRs per person. On average, we saw about 3, maybe 4 CRs per person. I don't think we had a single submitter that went over 12. So that was a great help to our volunteers, right? And looking at this, we determined this would not be a significant impact on the number or the quality of submissions, and would actually improve the quality of submissions by making submitters think through what they're submitting first. And of course, this makes us much better for volunteers and leadership. Next slide, please. As far as editorial CRs, we only wanted to allow substantive changes, right? So we had to define what this is. So we came up with the concept of a meaningful change. And a meaningful change we call something that addresses meaningful impacts to the code, meaningful modifications. So we had to come up with a definition, a change that alters the intent or meaning or provides further technical clarification for any given code section. We would have CRs that were submitted that were editorial CRs, right? They were editing the MAC for punctuation, for grammar, for consistency among itself, for formatting issues. And instead of taking up space among the TRC to evaluate those individually, we would shuffle those off to the side. They could still be submitted. They just didn't go through the TRC review process. Next slide, please. Another aspect to it is we didn't allow MAC Annex CRs. We have to remember that the Annex is under the purview and discretion of the CDC. It's changed when the code is changed. And the Annex is supporting documentation. So really, we felt that CRs were not necessarily well aligned with Annex CRs, rather, were not well aligned with what the intent of the review process was. So having Annex CRs also adds very much an unnecessary complexity and confusion to the review and voting process, and having Annex CRs removed from the process really streamlined and made it a much more manageable process. That does not mean we avoided all CRs, or avoided the Annex, rather. Instead, we built a standing committee, which we already had. We already had an Annex committee that formed every cycle to review the Annex. What we did do was formalize that process and task the Annex committee with 3 areas, right? One is reviewing all of the CRs that were likely to pass based on TRC vote to see if Annex information was warranted. The second task was reviewing the existing Annex for any needed updates or modifications based on science and data. And the third was evaluating the existing code to see if there's any areas that maybe we do need to have Annex language that does not currently exist. So those things were accomplished. Those were drafted up and track changes in the Annex and submitted to CDC for consideration. Next slide, please. So as far as the review process improvements, we moved to electronic submission of CRs. If you had submitted a CR in the past, gone are the days of having to download a Word document, fill it out, scan it, and email it back in. We went through a full electronic submission, would certainly ease the entire process all around. We also created the editorial review board. The point of the Ed Review Board was to address those editorial CRs. So again, we're talking in layers of checks and balances, right? So we wanted to remove editorial CRs from the MAC revision process and the debate process among the TRC, but we also recognize that that could be fraught with different challenges and things may fall through the cracks. So we created the editorial review board, which consists of myself in my role with CMAC, our TRC chair and vice chair, a CMAC board of directors member, and also a representative from CDC. So all editorial CRs that would come through, this board would review. And if it was anything but unanimous, then that change request was sent back to the TRC for review. So I think we ended up with about 12 editorial changes, and we ended up with about 4 or 5 that there was some question on that were kicked to the TRC for deliberation. Next slide, please. We also refined the roles of the chair and vice chair to be a little bit more specific in their approach. We automatically assigned CRs to TSCs, removing the need for the individual TRC members in their role as CR facilitators to have to assign that TSC. So again, more streamlining. An important thing we did was we changed the title of our CR champions, right? So up until this point, the TRC members would be assigned a series of change requests, and then they would quote unquote champion that CR, meaning by intent, they would lead the TRC discussion, do the initial investigative work, and present that CR to the TRC. The challenge was champion implies that they're pro, that they're supporting that CR, and that was not always the case. So to help clarify that language, that intent, we changed it to CR facilitator. And then, of course, we, as I mentioned earlier, we formed the TSC and TRC as soon as change requests were open. So we began work as soon as CRs came in. Next slide, please. So here's some submitted CR stats, right? Let's get into the nuts and bolts of what people are really paying attention to. Next slide, please. We had 201 CRs submitted, 4 that were withdrawn, 12 were identified as editorial in nature. We actually started tracking metrics. We knew anecdotally that more CRs came in the latter part of the review cycle, the submission cycle. But for the 5th edition, 50%, so half of CRs came in within the last 2 weeks of the submission window. So that's an important metric for us as we move forward in this review cycle. About 63% of the time, the TRC recommended a yes vote for any given CRs. 33% they indicated a no vote or do not adopt vote for the CRs. The TRC abstained on about 8, so less than 0.5% of all submitted CRs. Next slide, please. Another change, and it wasn't really a change, but something the board reaffirmed. In 2016 or so, the CMAQ Board of Directors issued a decision, decided to have a 60% voting threshold for a CR to be recommended to CDC to change in the MAC. So the current Board of Directors wanted to go back and reaffirm that decision, and so that was done. So a CR to proceed to track changes and for CDC consideration had to make at least 60% of the CMAQ voting membership. There were only 5 CRs that received more than 50% to adopt, but less than the 60% threshold. We'll talk about those in another slide. Next slide, please. So membership voting stats, right? How did the membership vote for CMAQ? 57% of CRs had a adopt vote. 35% was do not adopt. We had 1 CR that actually received a tie vote. That CR did not have in that tie, it did not meet the 60% threshold, so that CR was not approved by Board of Directors. How did the membership vote along with the TRC? About 90% of the time, the TRC vote was in line with the membership vote. And we see that being fairly consistent with other versions of the review cycle process. Next slide, please. CRs by type, we had 12 editorials, 62 revisions, 112 new CRs. We had 4 that were delete and substitute, and then 3 that were delete with no substitution. We're going to keep tracking these types of metrics as we move forward. It's relatively easy to come up with, and these are important data sets that we need to have as we track the evolution of this thing called the MAC. Next slide, please. From committee submitted CRs, we had several different committees. Surf venues submitted 8, including 1 rather large. We had the artificial swimming lagoons ad hoc that submitted 2, including 1 rather large. Ongoing efforts with the MAC ISPSC PHTA2 Harmonization Committee resulted in about 18 change requests. 11 were centered around single-class splash pads from that ad hoc committee, and then 6 from our lifeguarding review ad hoc committee. Next slide, please. From a CDC ratification standpoint, what was accepted by CDC, 95% of the CMAQ Board of Directors recommendations were approved. 6 CRs were rejected outright. 1 CR that received a do not adopt was accepted by CDC. We'll talk about those a little bit later. I do want to go back and clarify the process, right? Anyone can submit a change request to the MAC. Anyone, doesn't matter who. We had a lap swimmer submit a change request for this edition of the MAC, right? Not even in the aquatics sphere or the public health sphere. Anyone can submit a CR. The TRC deliberates the submitted CRs and then issues a voting recommendation to membership of either adopt, do not adopt, or abstain. The extensions are when the TRC cannot come to a consensus, meaning the TRC itself doesn't meet a 60% threshold for that CR to receive a formal vote. So the TRC recommends to membership. CMAQ membership actually votes on the code changes, and then the board of directors ratifies the membership vote, which then goes to CDC for consideration. So a little bit of a nuance there on how this process works. The key thing is checks and balances, right? There's checks and balances throughout this entire process, and it functions very, very well, we believe. Next slide. So what do we learn from this cycle of revisions, right? We learned that website functionality was an issue. We did have some issues with CR numbering and sorting. The voting process reported some as being overly tedious. So we're going back and we'll be reviewing that for improvements for the next cycle. It's important to note that we did some beta testing of the CRs, but the website and the submission process, the new submission process, was not really able to be tested until we went live. You can only beta test so much. You can build the best box in the world, but when you hand that box to a 4-year-old, you'll find out very quickly how fast it can be broken. And I'm not trying to insinuate that, you know, all of our stakeholders are 4-year-olds, but the general idea is there, right? You have something that's built and then it goes live. You find out very quickly it can break. So we had some of those issues identified that we'll be correcting. On the TRC simultaneous review of CRs as they came in, that was something that was really good on paper. It sounded really good when we talked about it out loud. What we learned in reality is that it would tend to be more cumbersome than what it was worth, to be perfectly honest. It made it hard to assess similar CRs, harder to group by topic. We ended up having to jump back to 3, 4, 5 meetings of notes to see how we voted on one particular thing and how that relates to the CR we're discussing today. So that made it a little bit harder on those similar CRs. And then the submission review from an internal standpoint, we had some issues catching formatting errors, naming errors. That's a reminder that we need to do a better job of that in the future. So those are our overall lessons learned from this review cycle. Next slide, please. Okay, here's the nuts and bolts. Next slide, Olivia. Talking about notable CRs, right? From the MAC ISPSC Harmonization Committee, the overall goal of that is to review both codes and to minimize areas of disagreement between the two codes. This also extends to PHTA2, which is a relatively new operating standard released by PHTA. I don't have an exact number, right? This is not an exact statistic. But if I had to put a number to it, I'm happy to say that about 90% of the existing ISPSC content is harmonized with the MAC. There were different areas where we changed a few things, ISPSC changed or committed to changing a few things, but we're about 90% harmonization, and we're harmonized on pretty much all of the major areas. Small things like the ISPSC has language for floodways. in flood zones. The MAC does not because, well, the building department has to approve that. That's out of scope for health officials, right? So there's lots of little stuff like that. But as far as the existing content in ISPSC, it's largely harmonized with the MAC and will continue those efforts. I do have to say this, the MAC is still a much larger, more exhaustive set of content for a model code language. And we'll see how those items are harmonized in the future. But from the existing language in ISPSC, there's very, very few differences now, which is really wonderful. And one of the major goals of this harmonization process. So we have 17, I think I said 18 earlier, CRs were submitted on behalf of this committee. Actually adopted by membership were 8. Among those that were rejected were about 6 around that circled around floodways language. Next slide, please. So what was added? Construction tolerances, diving board occupancy, spa alarms, requiring clocks for spas. The ISPSC prohibited equalizer skimmers. The MAC did not, so that was included. The ISPSC included piping inspections before backfilling trenches. The MAC did not, so that was included. And we've already discussed the floodways language. Next slide, please. And a major milestone, language revolving around artificial swimming lagoons was added to the MAC 5th edition. This was included in section 7, which is special venues, which is another structural change from prior editions of the MAC. So, you know, this was really, really a big win. These are very, very big, very large, complex facilities. And I'd love to talk more about this. That's an entire webinar on its own. So please feel free to reach out to me if you have questions about ASLs. Surf venues are another novel facilities, novel venue that was we've been addressing for the last couple of years. The surf venue language was 2 points shy of passing and was not adopted. So it made 58%. So this means that we still have some work to do on surf venues. Major concerns were around turbidity, specifically what's an acceptable level of NTUs, Nephelo turbidity units for surf venues, lighting for night surfing, and there's some additional questions around lifeguarding and bather supervision. So surf venues is being flagged before the next edition of the MAC goes into the submission cycle, review cycle. We will work on improving this change request for a hopeful successful submission to the 6th edition MAC in a few short years. Next slide, please. We established a committee to look into single pass splash pads. This was coming out of a conversation with Michelle Hofsa from CDC, where how safe are these things was the starting question. And the answer was, we don't really know. So we formed an ad hoc committee to look into single pass splash pads, and we did kind of a deep dive, and we found some really interesting things, right? One thing that came out of this was requiring single pass design to accommodate flushing and draining, right? Requiring that it's flushed prior to daily opening, right? We refined the language. Non-recirculating interactive water play feature is the official term for it in the MAC. But the biggest thing we found was that when a municipality is issuing, or an AHJ is issuing a boil water notice or a water quality advisory, the single pass splash pads, the flow throughs, they weren't being closed. So you had this do not consume order, do not drink, boil before use, but kids could go to splash pads and have this contaminated water coming out of the municipal water system or whatever water system, and be potentially impacted from whatever pathogens has caused the advisory, right? Whether it's a low quality, a low pressure issue, or maybe some sort of contamination. So that was a huge thing that we figured out wasn't being done. So part of the MAC now is for this non-recirculating interactive water play feature for our flow through, our single pass splash pads, is that when there's a water quality advisory issued, that the facility is closed for use and flushed prior to reopening. Major, major thing there. Next slide, please. We had our lifeguarding ad hoc reviewed the lifeguarding bather supervision language and made several recommendations. These were largely adopted. Notable CRs include, next slide, please, adding at least 2 lifeguards where there's a single zone of patron surveillance. Many of us have been in facilities where there's 1 lifeguard for a 6-lane, 25-yard pool. That's a single zone of patron surveillance, right? The MAC has largely been historically silent, other than requiring lifeguards and complying with the safety plan, right? But the MAC has never really addressed should more than 1 lifeguard be on duty. So the lifeguarding review committee decided to take that among themselves, had some really, really deep discussion. And one thing that's noted is there's not a single major training agency curriculum that contains content on single lifeguard rescue and resuscitation skills. They're entirely based off multiple lifeguards on duty. So this was a gap that existed, and this is a great example of evolution, not revolution. When the MAC was first created, just having lifeguards was a big enough thing, right? But now we're evolving the MAC to where we're recognizing the challenges of single lifeguard facilities and requiring at least 2 be on duty. Not necessarily in the stand, but 2 on duty to rotate out with each other and, more importantly, be able to respond in an emergency. Next slide, please. Other changes including requiring lifeguard or guard on uniforms, revising a language for lifeguard supervisor qualifications, clarifying supervisor roles can't interfere with patron surveillance. You cannot be a lifeguard supervisor and sit in the chair providing surveillance and perform your supervisor roles. Those have to be 2 separate role types. The supervisor can sit, but you'd have to have a secondary supervisor to lead the staff when required. Adding the benefits of oxygen in drowning care and resuscitation into lifeguard training curriculum was another change. Next slide, please. We had other CRs that were submitted by individuals, not a committee. We're grouping those by topic for our purposes here. Next slide. For imminent health hazards, CRs were submitted that modified the MAC to add a lack of or improperly functioning interlocks, as well as improper chemical storage, and requiring closure when the sanitizer concentration reaches 10 parts per million or higher. It's really wild that we're having to add the interlocks and the imminent health hazards. To this day, we still have accidental chemical releases, which are largely attributed to a lack of or improperly functioning interlocks. So now that's a closure item in the code. Next slide, please. Disinfection related, there was a CR that added a 300 part per million closure item and remediation when the cyanuric acid level reaches 300 part per million. This was historically in the MAC. It was removed from the 4th edition until a deep dive could be done into the white paper that spawned this recommendation from the EPA, the swim model research. And this was included for, put back in rather, for the 5th edition. Next slide, please. Design and construction, having handholds on wing walls and peninsulas opening up to drinking water quality flow meters, requiring inlets at stairs and ramps, modifying the minimum gallon per minute filter media rate for sand beds where they're greater than 24 inches to no more than 15 gallons per minute. And then another one is adding a pressure switch as an interlocking device. Pressure switches have been around for a long time. They're heavily used, and this is recognizing that, yes, they are a valid interlock. Next slide, please. Another major addition, major change for the 5th edition was recognizing that when you're dealing with fecal contamination in the presence of cyanuric acid, that dilution factor can be used in your inactivation time. So this is a really complex CR. The math behind it is amazing. That is well above my pool operator brain. But it's allowing.
All right, Dew will be joining us momentarily. Thank you all for your patience, and we will resume very soon.
Folks, I apologize for that. It looks like my Wi-Fi in the building dropped. So many apologies. So anyway, kind of picking up where we left off at, this is a very interesting CR that was added to account for solution by dilution to contribute to remediation from an accidental fecal release. Next slide, Olivia. Great, thank you. So now we'll discuss those that did not meet 60%. Next slide. So one was a CR that would modify the turndown system to a performance-based versus a 25% minimum flow. So when we talk about turndown system, think VFDs. Currently in the MAC, there's a maximum turndown of 25%, meaning that when the pool is not being used for bathing, you can turn the VFD down, save a little bit of on energy. This one has some really interesting discussions. The CR that was submitted was more of a performance-based system that indicated as long as the pump is not cavitating and the interlocks are working and the accessories are working like the heater, that you could dial it down further than 25%. The TRC didn't necessarily agree with this in mass. It did go to membership as a vote. This almost met the threshold. So we're going to go back, and this one identified for additional work for the 6th edition to see if we can come up with a solution. Maybe the answer is no. We don't know yet. Next slide, please. So 573115 did not pass membership. It did not meet 60%. And this would modify the operating range of sanitizers to align with labeling requirements with FIFRA. We're going to talk about this one momentarily. This one was very interesting. This is actually one of the ones that CDC overturned. So CDC accepted a CR that did not receive the minimum vote to move forward from the board of directors, from membership rather. Next slide. So we have another CR that requires a lifeguard or a person stationed at the top of the slide and a qualified lifeguard at the end of the slide. Again, this did not meet 60%. There were significant discussions over the type of features, the type of slides. Is this really required? And again, this one is not ready for prime time. Again, we will pull this one out and reevaluate for the 6th edition. Next slide. Next slide, Olivia. I may have a little bit of a lag. I apologize if I do. Okay, here we go. This is surf venues. So we mentioned earlier the surf venues did not pass based off NTUs, of lighting concerns, and off of lifeguarding concerns and bather supervision. On the NTUs, the actual change request allowed up to 5 NTUs versus 0.5, which is more aligned with swimming pools, normal swimming pools. The CR recognized that these are novel venues included specifically for surfing, and that wave action would likely increase turbidity. So that's an area that's still going to need more work. Public health really had some concerns over NTUs. On the lighting issue, again, public health had serious issues with lighting because we're talking about very large bodies of water. Think acres of water for a surf venue. You can't throw in your typical in-water pool lights and have adequate illumination. So that was another concern. And then recognizing that lifeguarding these things are going to be different. The typical lifeguard really isn't suited for a surf venue. So there's a lot of debate and discussion over what that looks like. In addition to the membership not really being fully on board with it to meet that 60% threshold, CDC Center for Injury Prevention expressed the same concerns. So this one We're going to go back and really work on it, and hopefully we can get this one through for the 6th. Next slide. So what are our next steps? And let me go back a couple of slides. You don't have to move backwards, Olivia. But on the prior slide that discussed labeling requirements, the one that was accepted by CDC, the big concern there was the MAC has always had this tension along with labeling requirements. The CDC perspective and the industry's perspective is that the labeling requirements really apply more for drinking water and not for swimming pools, because the labeling requirements are from the EPA essentially, right? In a nutshell. So there was always that dynamic and that disagreement. But this CR was submitted, and one big thing that played into its inclusion in the 5th edition MAC is a simple fact that FIFRA is a federal law, right? So if we don't have this language to comply with labeling, we know the MAC may be running afoul of a federal law, which, with a federal entity being the CDC and a federal document being this model code, obviously that was a bit of a challenge to overcome. And this is also coming out of the ISPSC harmonization, where the ISPSC was very vocal in concerns over the labeling requirement. So that's the impetus for this labeling requirement, right? And by the way, if you're following the labels on the pool chemicals, specifically the sanitizers, no operator is going to want to run higher than 5 anyway on a regular basis. So it's really not an issue to incorporate this into the MAC. That's where we see the change for the 10 part per million, because up until this edition, the operating range was a minimum of 1, 2 in the presence of cyanuric acid for the MAC, and then a maximum of 10 part per million. So moving that 10 part per million to a closure reinforced this issue of here's this maximum level that is likely going to be a public health risk, and this is a closure item, but at the same time honoring and following the law for the labeling requirements. So what are next steps for these CRs? They're flagged for the next cycle. We're going to evaluate the votes and identify if these CRs can be easily improved. It may be an issue where we go back to the original submitter and work with them on improving the CR, or we might form an ad hoc committee to look at these individual CRs and improve them for submission. We're still very early. The 5th edition just came out. We don't start the review cycle for another year and a half, approximately. So these will be items that we start looking at in January of 2026. Next slide. Okay, we've already talked about that one, Olivia, so you can forward through. That's simply the CDC rejections. Oh, well, we'll talk about this one. And I'm sorry, my dropping Wi-Fi got me a little discombobulated. I apologize for that. So another CR was submitted that added additional warnings and labels to tall diving platforms. These are your 3-meter boards and higher. These are the large diving boards, not your standard 1 meter, where you really got to climb up a ladder. And you're at a very high elevation, practically speaking. So this was submitted and approved for incorporation to the MAC. However, again, we run into the limits of what the CDC can do. The CDC does not have the regulatory authority to dictate labeling requirements to manufacturers. So well intended, everyone agrees with this being a good safety item and practice. However, it's outside CDC authority, so it was rejected from the MAC. Next slide. There was another rejection regarding waterline, and largely it was redundant. It was already addressed in another section, another CR. So CDC rejected that one just from not having redundant language right next to each other in the MAC. Next slide. All of these are related to glossary items around surf venues. These obviously were rejected because the larger surf venue item did not pass. Next slide. And then here's the discussion around the labeling requirements. and the change to comply with the FIFRA labeling requirements here. Next slide, please. Okay, so I have to do the plug, right? Come join us over at CMAC. Our motto is driven by your expertise. We can't do things like this and other things we do without your support, whether it be through membership or for adding your voice to be heard or participating in any of our ad hocs and our working groups. Also, please follow us on LinkedIn at the Council for the Model Aquatic Health Code. All right. With that being said, Olivia, I think that's it for me on announcements. I think we had several questions come in through chat.
Yes, and thank you so much, Dewey, for that thorough presentation regarding the changes to the MAC 5th edition. So
Great,
much
thank you.
appreciated. So yes, we're going to go get into our Q&A session, and I'm going to take a look here. I do see some comments about the NACCHO CPO scholarship. So yes, that will be shared out in the wrap-up email that will be sent out in a few days. Let's see here. Have some comments about is one comment says, please provide thoughts on using chlorine dioxide in fecal accident situation for shock treatment in RFWs if not already included.
I mean, the thoughts are it's in the MAC, right? The MAC is used, chlorine dioxide is used as a sanitizing agent in the MAC. So yes, absolutely. Um, you know, chlorine dioxide is an interesting little beast. It's a highly effective sanitizer. It can be a little interesting to use. I've never used it personally. I've talked with folks that have, and they all agree on one thing. Yeah, it'll kill bugs like crazy, but it can be a bear to use. You have to think about certain protections, PPE for staff that are handling it, and the general consensus is, chlorine dioxide as a gas, maybe not so much. Some of the more liquid versions, there's definitely some merit there. I would point out that although chlorine dioxide would likely be very effective in a fecal incident, it is not currently in the CDC fecal incident remediation protocol. So you could use it maybe as a secondary disinfectant, but you would still have to meet that disinfection protocol.
All right. Thank you for that. Another question here is what year is ISPSC referencing?
The current 2024, but we are anticipating additional work, and we have done additional work for the 2027 version. So once the 2027 hits, then we're certainly going to be in that high 90% harmony between the two codes as far as existing language. So I can't go into details of what we anticipate to happen. We'd rather it be released on their end and let them make the announcement. But once the 2027 comes out, it's going to be a pretty rock solid product that aligns with the MAC.
Okay. Another question states, any thought about lifeguard staffing based on a number of projected bathers, patrons?
Yeah, the big thoughts on that is that it doesn't work. Because then you're talking about, okay, what type bathers, what type patrons? There's a big difference from providing bather supervision for a NCAA swim meet where you have 200 swimmers and when you have a learn to swim class of 24-year-olds. So, trying to base it off a bather type from a regulatory standpoint just doesn't work, right? You're trying to decide who's less valuable or who's more valuable, who needs more protection. So this would really be along the lines of look at your safety plan. That's where this is addressed. We have lots of aquatic experts running facilities. Their input needs to be listened to on staffing and bather supervision. Yeah, and that's really the challenge, right? So if you talk about the number of bathers and square footage. Neither of those approaches take into account the very real issue of who are we actually supervising and what protections need to be there, right? Kind of along those lines, 30 Navy SEALs coming in to do a fitness swim carries a much different risk level than 30 cardiac rehab patients participating in their first water fitness class after having coronary bypass, right? So you have to account what type bathers they are, what are those risks, not just numbers.
All right, thank you for that. Another question says, can we get certificates for CEs? So yes, we can provide certificates for those who um, would like to receive them. All right. Another question for you, Dewey, is will a summary of changes be released with the new version?
Yes, those should be up on the CDC website. If not now, they will be. I know there was serious talk about doing that. That's going to be a CDC end. Unfortunately, if you're not aware, there's an HSS blackout, communications blackout for all federal health agencies to varying degrees. And our partners at CDC are under one of the more stringent blackouts. So we don't know when that'll be posted, but that will be posted at some point in the future on cdc.gov/MAC.
Thank you for that. Another question states, will the lifeguard single zoning thing take into consideration the presence of additional aquatic staff, such as swim instructors, coaches, aerobic instructors, staff that play additional roles in the EAP?
Additional staff, yes. We have to remember that you can't teach swimming and lifeguard. You can't coach and lifeguard at the same time. The MAC is very clear on that. The annex is very clear on that. Industry standards are very clear on that, right? So let's game this out for a minute, right? As long as there's another lifeguard to respond and rotate in, then you're meeting the spirit of the intent. That could be a pool manager that's in their office and they're rotating out based on a rotation plan. It's having someone highly trained available to help in an emergency and rotate in. So you can't teach and coach and lifeguard.
All right. Thank you for that response. A similar question is, do we default to in single zones, follow the MAC or certifying agency?
Well, keep in mind that you default to their AHJ at the end of the day, right? The MAC is not, unless it's adopted by the AHJ, it is just a series of model codes and practices. Impactful, yes. Used in litigation, yes. But the MAC is really where we learn and talk about actual staffing. Again, I'll go back. The major certifying agencies, the American Red Cross, the YMCA of the USA, Stargard Elite, and Ellison Associates. None of those major agencies, which account for 95+% of all lifeguards trained. There's a few minor agencies that are I'm not going to say they're good or bad. I don't know most of them, but they don't do a majority of the training, right? They're single digit percentage wise. All of the major agencies are in alignment in that multiple lifeguards are required, multiple lifeguards on duty are used in response scenarios and to rotate in. There's not a single one that says, yes, it's okay to have a single lifeguard. They all are based off multiple lifeguards, certified lifeguards being able to respond to an emergency.
I have a comment here regarding your contact information. What's the best way to contact you if they have any further questions?
Dewey Case, DEWEY CASE at CMAHC.org.
And we'll also provide that in the wrap-up email as well.
Yeah, please do. Just know I do run facilities full time for Williamson County, Tennessee. So if you shoot me an email, it may be that day, it may be a day after. I do try to screen if it's something urgent that you need like today, please put in the subject line urgent, and I will make a point to respond that day. Otherwise, it may be a day or two.
Mm, and I see just one other question here. What is the best method for a local health district to adopt and incorporate the MAC within the local jurisdiction?
Oh, that's a good one. Um, Influence peddling. It's influence peddling, right? Um, we don't see holdups on the Mac because people think the Mac is awful. We don't see holdups on the Mac because it's an inferior product, right? We don't see holdups on the Mac because it's not protective of public health. The holdups we see on Mac adoption are in that political process, right? Either through nuance of regulatory language, like we have one state that I think for every new regulation they adopt, they have to drop three. You have weird things like that. And just the delays, right, that happen with whatever health district it is, right? Whether it's just the lawyers are overwhelmed and it's in the queue, but we have no idea when, or you might have some sort of lobbyist that's lobbying against it or lobbying for this product over the Mac. You have that whole nuance, right? So the most important thing for adopting this in your AHJ, in your jurisdiction, is influence peddling. How can you influence others that the Mac is really where it needs to be? A common issue that we see is cost, right? When the Mac was first released, Councilman Hunsaker, which is a national design firm, estimated that following the Mac resulted in about a 10 to 15% increase in building costs. That was over 10 years ago. Now, the difference between building to the Mac versus building to another code is a lot smaller. Now we're talking about you might be 5% more expensive. Um, so the cost is really a non-starter, right? Um, so we can take that off the table as a barrier. Um, but the big thing for adoption, it's influence peddling. It's playing the long game, right? It's what stakeholders do you need to influence? Um, what individual do you need to give more time to, more delicate conversations? Is there a local politician, councilman, congressman, state senator that maybe needs, you know, buy their lunch and have a conversation, right? And actually talk about it versus shoot an email. You've got to figure that stuff out and be influence peddlers.
All right. Unfortunately, we've run out of time, and we do have a couple other questions here. But like as Dewey provided, please feel free to reach out to him directly if you have any other questions. And also, you can also reach out here. There's an email box for NACCHO. So we have our mecnet@nacho.org if you have any specific questions for NACCHO. But again, thank you so much all for joining us. Thank you, Dewey, for that great presentation. And we thank you all for coming on today, this
Yep.
afternoon, and joining us. But be on the lookout for that wrap-up email.
Right.
And take care, everyone, and have a great rest of the
Oh,
day.
Olivia, quick question. I
Yes.
don't know if it's possible or not. Is it possible that we can save these questions from the chat and
Mm-hmm.
then I can answer them and then we can send an email out to participants? Can we do that?
Yes, I did take note of them. So that's a
Perfect.
perfect idea. So those we didn't
Okay.
weren't able to get to. I see there's a few others that were in here. I took note of them and we'll make sure we get to you concluding the call today. So
Awesome.
yes,
Great. Thank you, Olivia.
perfect. You're welcome. Take care,
Okay.
everyone. Thank you all.
Thank you all.
All right.